So Jasmine has epilepsy. She just started having seizures one day. She was 3. We went to the emergency vet and they referred us to Dr. McDonald, and we started her on medicine, which I was very surprised it's the same medicine people take for epilepsy. And then I know I was really scared when her seizures got worse.
Harper started at the age of 1 with seizures. I had never dealt with a dog with seizures, so was clueless in the middle of the night when she had one what was going on. We went to see our vet, and he recommended that we see a neurologist.
When your cat is having a seizure or your dog can't walk, you want to know the answers, and that's what we're here for.
I started videotaping her seizures so he knew what was going on. At that point, she was having 5 or 6 seizures a week, so it was really scary for us. He took the time, examined her, explained to us everything about seizures. I think he really saw how concerned, stressed, afraid we were with this whole thing, this little puppy, and had no idea what was going on.
I mean, Dr. McDonald, I even asked when I was crying, and he was like, "We're fine." He's like, "She's good." Like, he was like, we're gonna figure it out. Like, she's fine, and he was right. So, but yeah, it was very scary, and he was very comforting, calm the entire time.
We oftentimes will have an exam. We will have the animals evaluated with in-house blood work, radiographs prior to anesthetizing them for an MRI, and that can all be done in one day.
It's 100% easier than being able to do everything in one location instead of having to travel to one location for an MRI, to another location for blood work, to another location to see a specialist. Everything is a one-stop deal.
Anytime your pet is in an emergency or you perceive your pet as being in an emergency, it's important to be able to contact your pet's care provider. We partner with the Pet ER so that if your pet is experiencing an emergency situation, they can be evaluated 24 hours a day, 7 days a week through the emergency service.
They know Harper. It's not like you're coming in and it's like, who is this? Harper is known because we are a frequent flyer. And I feel very comfortable. Like I say, it would be like leaving her with a family member, and I know that she's in good hands.
He really calmed my nerves and my anxieties about everything. And when I brought her home after we finally got her seizures under control, he was available if I had questions, and he called and checked on her, and made me really feel like, okay, like, we got this, like, she's going to be okay.
One of the best feelings that everyone here has is when they see a patient come back in who was paralyzed and we're able to treat and is now running around and full of joy.
Harper now, 5 years later, is down to a seizure every 2 months, if that. She's back to doing everything, chasing the birds. She has a great life, and she's a happy dog.
He saved her, and she's my baby, so I'm grateful for them.